We'll have Dr. Dix now speak on medications for FMD.
All right, so let's get this rolling here. So first question, maybe, let's go back. All right, there we go. Should patients with FMD be on an aspirin? All right, overwhelmingly, yes. All right, so let's talk about antiplatelet therapy. So antiplatelet, that's what aspirin is considered. It targets the platelets. There are other ones, but probably the second most commonly used one would be clopidogrel, or the trade name is Plavix. And there's a lot of convincing data to use these medications for patients with atherosclerotic disease, right? So with atherosclerotic disease, you have plaque that can rupture and platelets tend to stick to that, and these medications are beneficial to try to prevent that from happening and have been shown to be helpful for reducing risk of heart attack and strokes. But I get this question quite commonly at this point in clinic: is isn't aspirin bad for me now? There's a study that came out in 2018 suggesting that we probably, as providers, were overdoing the aspirin. There for a while, pretty much every patient, once they hit a certain age, was put on a baby aspirin thinking we were preventing heart attacks and strokes. And the reality is we weren't doing what we thought we were doing for most patients. But the question then is, what about FMD and aspirin? And so the rationale for aspirin in patients with fibromuscular dysplasia is that with the irregularity of the artery, you can have turbulence of flow. And with that, we think that there is some platelet activation, which can increase the risk of developing a blood clot, which could then lead to a stroke or other cardiovascular event. Or the issue is we don't have data to show the effectiveness of aspirin in patients with fibromuscular dysplasia. So, based on models, it makes sense, but there isn't data suggesting that if I put you on an aspirin, we're going to reduce risk of stroke by this amount. But that being said, given kind of the mechanisms, most patients are recommended to be on an aspirin. And kind of the data that we have thus far is that about 3/4 of patients with fibromuscular dysplasia in the registry are on an aspirin. And the biggest kind of factors that seem to be associated with aspirin use are age and prior cerebrovascular event, so stroke. Makes sense. Usually if somebody's had a stroke, there's a much stronger push for them to be on an aspirin, but across the board, most patients are on an aspirin. And this fits with the first international consensus recommendation in that the wording is it's reasonable for patients with fibromuscular dysplasia to be on an aspirin if they don't have a contraindication. And the biggest contraindication we're thinking about is aspirin can increase the risk of bleeding. And so if there are concerns from that perspective, then it really warrants a discussion with your provider. What if you've had a dissection? Now this gets a bit more complicated, and I'm going to skip over some of this because I think it's going to be touched on the next presentation. Oops. But there's a lot of medications that we have available to choose from when somebody has had a dissection, and it's far from straightforward. This is a kind of an algorithm that can be beneficial for us, depending on different risk factors and based on the imaging as to what might be the best medication. But I think the consensus is still out with regards to best treatment medically, at least. Oops, I'm getting aggressive with the clicking here. All right, should patients with FMD be on a blood pressure medication? I think this is another classic trick question on my part because it really depends, right? So being on a blood pressure medication is quite common amongst patients with fibromuscular dysplasia. About 3/4 of patients with FMD will be on some sort of blood pressure medication. And, as Dr. Kim said, it could be the reason you are on a blood pressure medication is usually because you have high blood pressure. And that can be because of the FMD or can be because of run-of-the-mill essential hypertension. This schematic shows the complex pathways in which FMD can result in high blood pressure. But the long and short of it is that with this irregularity of the renal artery, it can result in the kidney sending out hormones that raise the blood pressure. And so with that, we have medications that target that. And so a lot of the more commonly used medications are classified as either ACE inhibitors, so lisinopril, benazepril, or angiotensin receptor blockers like losartan or valsartan. But we have a lot of other medications available to help control blood pressure. So why do we care? Why is blood pressure control important? Well, for FMD specific reasons, we want to protect the arteries. Keeping the blood pressure under control is beneficial to keep the arteries healthy, reduce the risk of injuring or injuring the aneurysms, resulting in your aneurysms growing or rupturing, reduce the risk of dissection. And then holistically, there's plenty of data showing that blood pressure under good control reduces risk of heart attack, stroke, and cardiovascular death. And so what is our goal? Well, the ideal blood pressure in patients with fibromuscular dysplasia is unknown. And so for most folks, we end up using kind of the standard recommendation, which is a blood pressure of less than 120/80, which is the recommendation from the American Heart and Stroke Associations. What does the FMD registry tell us about the use of blood pressure medications? So the blue bar are patients with renal artery involvement, and the orange are those with cerebrovascular, so carotid involvement. And you can see, which is not surprising, that patients who have renal artery involvement are much more likely to be on a blood pressure medication. But the choice of blood pressure medication is quite varied, and there's no consensus as to what's best. And so the things that seem to predict patients being on blood pressure medication are age again, and then prior therapeutic intervention. And so this is particularly if you've undergone a procedure to try to improve the blood flow to the kidney. There are a few special considerations in terms of what might be the preferred blood pressure medication. So if people have blood pressure issues that we think are being driven by the kidney itself, then being on an ACE inhibitor or an angiotensin receptor blocker makes sense. For those who've had a SCAD event, we often use beta blockers. And then as mentioned before, with the migraines, there are certain blood pressure medications that can be beneficial for trying to prevent migraine onset. This was already touched on, so I'm actually going to skip over this. There are a few other considerations. So this is a common question that comes up. Do I need to be on a statin? And there's no straightforward answer to this either. You know, it's not we don't feel that statins are particularly helpful in patients with fibromuscular dysplasia. So then it really kind of comes down to holistic cardiovascular health and looking at cholesterol to make that determination. Another common question is hormone therapy. And this one is also, I would say, is tricky in that I don't think we have clear recommendations about this. There is some concern about the impact that hormones play on FMD, and that, you know, in patients who have high blood pressure or prior dissection, we often try to think about coming off of hormone therapy, but that often involves a discussion because often these medications are providing benefit in some way or fashion. All right, last question. Which of these medications should be avoided in patients with FMD? So we have, these are all antibiotics. We have cephalexin, which is a cephalosporin, ciprofloxacin, which is a fluoroquinolone, nitrofurantoin, which I don't know the class, and penicillin. You might know the class of nitrofurantoin? It's like its own thing. And everybody's saying Cipra. You guys are on top of it. Yeah. So just a few medications that we often recommend avoiding. So we touched on the triptans with migraines, and then some of the stimulant medications, particularly a lot of the ADD medications, can increase the constriction of blood vessels, which is concerning for risk of dissection. And then same with fluoroquinolones has been associated with aortic tears and ruptures. So that's all I got for y'all.